Radio. Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yaden.
And thank you, Braley. Welcome, everyone. We are live from the Managed Medicaid Studios here for another episode of Medicaid Matters, the only live national interactive talk show about the business of Medicaid health care. Today is Tuesday, October 30th, 2012. I'm Richard Yaden, President and CEO of Managed Medicaid Services, and your host for the next hour. Well, we have a full show today. We're going to cover a lot of ground, so get your pen and paper ready. I know you're going to want to be sure to take some notes. We're going to open up some new territory. We're going to talk about some developments that have been going on in Medicaid. We're going to talk about how you can get a $200 discount on a very important conference that's coming up. And in just a few minutes, we're going to be joined by Marie Schwartz, who is the Managing Director of the Medicaid Learning Center. We're going to hear all about that tremendous resource and what she's doing there. And in the latter half of the show, we're going to really get into some of the implications of Medicaid, or some of the implications for Medicaid, and the upcoming elections now just 1 week away. Hard to believe, but we've been hearing about this for almost 2 years, and we're getting right down to the final days of it. So we're going to talk about that, and as I said, we're going to talk about how you can save $200 off one of the most exciting Medicaid conferences that's going to be coming up in February of next year, something I'm sure you're going to want to be in attendance, so stand by. Well, we need to really take some time here as well and to acknowledge our friends, our listeners, and our viewers, and our clients that are in the Northeast and all other parts of the country affected by Hurricane Sandy. I know many of you are going to have to listen to today's show as a replay because you don't have power. By last accounts, from what I saw shortly before the show started, there were over 7 million people without power right now. And we're just beginning to hear about some of the damage that was caused and the implications of that storm, which by all accounts really seems to be on a historic scale. Here in Nashville, we're getting a lot of wind, and that's about as bad as it's going to get for us. I know farther east of us in the higher elevations, a lot of snow is coming in. In fact, we were going to have an additional guest on the show today, but could not make it because she had to stay in her home state due to the hurricane and things that are going on there. I was speaking with my son last night, who's attending school in Rochester, New York, and he was telling me about the wind and the rain up there that is setting records as well. Certainly nothing compared to what you're seeing in New Jersey, to what we're hearing about and what we're seeing in New York City and Long Island and places like that. So certainly our prayers are with you. We will be supporting the relief effort as that begins to get underway. And I want to encourage everyone in our audience today to support your local and your national relief efforts with your donations. This is a time, really, we're in a superheated environment in our country right now, superheated about all the differences that everyone has, highly politicized, highly polarized. It's these things, though, where we can put those differences aside and really help our fellow citizens. Well, if you're at the MedicaidTalk.com website, you see some big changes. We have transitioned to a more streamlined web platform. We're taking the show from our company page to having its own web presence all by itself. Your comments and your critique are welcome about the new site, so please don't be stingy. We want to really strive to create the best environment, the best viewing environment, the best listening environment, and experience possible. So we really want to have your feedback about that. Well, as I mentioned, we're going to be covering a lot of ground on today's show, and we want to hear from you about these topics. We're ready for your calls now, and the number is 626-657-2125. That's 626 657-2125. You can speak with me. You can speak with Marie when she comes on the air here with us in just a few minutes. We want to hear your opinions. We want to hear your comments on today's topic or anything related with the business of Medicaid healthcare. That's what we're here to talk about. If you can't call, you can reach us on Twitter. You can send a question or a comment to @MedicaidTalk. We'll get those on the air as we have time. And for our regular viewers, you know that we often have a chat site set up right next to the screen so that you can participate in the show that way. Unfortunately, we have not fully tested the chat feature on the new site, so that's not available today, but you can send me an instant message. You can IM me your thoughts or your questions via Skype. First, you need to send a request to me at our Skype ID, which is Medicaid Talk. Be sure to mention that the show is in your invitation, so we know that's why you're sending us that message and why you're connecting. And then once that's done, just takes a few seconds, then you can IM a question or a comment to me, and we'll get it on the air. All right, well, with us on today's show is Marie Schwartz. Marie is the Managing Director of Barry Dunn's subsidiary company, the Medicaid Learning Center. Marie is also a project management professional and a certified Medicaid professional with over 25 years of health industry experience. Her professional background includes managing the state of Idaho's Medicaid contracts and recovery unit. So she's here with us today to talk about the Medicaid Learning Center. And Marie, thank you for being on the show today. Welcome.
Thank you, Richard. I appreciate this opportunity.
Well, we were a little concerned about you being able to participate today because I know you are coming to us. You're calling in from Washington, D.C. Just real briefly, is there anything you're seeing there in terms of the hurricane's impact?
It's been very windy and rainy, and we actually have power now restored here to the hotel, but for quite a long time last night, the hotel had the generators going, and I know that a lot of people in the area have been suffering. So there's very little activity on the roadways. The train is shut down here. The shops, a lot of shops are closed. It feels kind of deserted, actually.
Oh my goodness. Well, it's a historic event, no question about it, and we're glad you're safe. We're glad you got the power back and you're able to get on here with us. I'm getting some feedback from my engineer that you're a little bit faint. Do you happen to be on a speakerphone?
I am not on a speakerphone. No, I'm on a regular handheld unit.
Okay. Well, we're going to try to work with it here as best we can. So we'll make sure everybody gets to hear exactly what you've got to say. Well, I talked a little bit there in the introduction about your background. Tell us how you got involved in Medicaid and a little bit more about what you're doing today.
Sure. I've been in the healthcare industry for a very long time, and I worked for the state of California, and then when I worked for the state of Idaho, I went in to work for their Medicaid unit. I eventually became the manager of the contracts and recovery unit there in Idaho and worked on several of their procurement projects. It was a very interesting experience for me, and after I left the state of Idaho, I went into consulting and worked with a consulting company that did a lot of different types of consulting for Medicaid agencies. And so my background is pretty vast between Medicaid, between the healthcare industry in general, and then now with Medicaid training. We believe long ago when I was with the state of Idaho, it was difficult to onboard people into the Medicaid space because there wasn't any standardized training or certification programs or anything of that sort that people could actually use to get up to speed in Medicaid. And so this thought has been in the works for years of how do we actually provide good training to folks to help them get into the space more easily and become more productive as Medicaid professionals.
Well, it's Medicaid is just a vast topic. There are so many parts to it, so many moving pieces. I know it varies so much from one state to another. Tell us a little bit about the Learning Center. Who uses the Medicaid Learning Center?
The state Medicaid agencies themselves that we have worked with are several, and then we also work with the vendor community that supports state Medicaid agencies, and some of the folks at CMS have gone through our trainings as well. We also supply trainings to the National Association of Medicaid Directors, NAMD, and also NESCO, the New England Consortium of States. So we typically provide Medicaid education and services to a wide variety of folks within the Medicaid community. Mr. Rick Friedman, who was with CMS for years and years, talked about the Medicaid community being like a three-legged stool. There's the states, the feds, and then there's the vendor community, and all three legs are needed to support the Medicaid programs across the 50 states and 6 territories at large. And so we have tried to put together trainings that will be beneficial to all of those different parts of the legs of the stool.
Mm-hmm. Now, do people enroll, or do you have programs that are kind of come as you go, or come as you are? You take the program, then maybe you come back for another course or something. How does all that work?
Typically what we do is we will have a contract with a state Medicaid agency to supply training to, let's say, 100 people within their organization. We'll go and we will do an on-site rollout where we provide some instructor-led classes to help people understand all the different courseware that's available to them. And then we help them set up the profiles that they need to create to start going through this online courseware. And then they get started, and they are able to, either the organization itself will direct them on how they want the courses to be taken, or it's self-directed in some situations. There's typically 18 courses that will provide you with your MCMP Level 1 certification as a Medicaid professional, and then there's 26 courses that take you to Level 2 certification as a Medicaid professional. And so in the grand scheme of things, you can typically see that people would take the basics first, the information that gives you, a foundation of knowledge in the history of Medicaid and that type of thing. People will typically take those first, and then they'll start building upon it. But every once in a while, a person might be heading right into an HIT project, for instance, and so their organization will say to us, let's have our folks focus on the HIT trainings first.
Mm-hmm. Now, I'm not a state agency. I guess if I were my part of that stool would be probably on the vendor side. What would I be looking for at the Medicaid Learning Center? What options would be available to me?
Well, the trainings that we provide across the board to all of the Medicaid community, we think benefit the Medicaid vendors, because if you need to understand the business of Medicaid or the history of Medicaid or how Medicaid is changing today, all of our trainings are trainings that can benefit you or your organization, because you will be able to, keep up with the things that are changing. In particular, in our courseware, we have, as I said, the certification program, but also when you purchase a seat with us and take our trainings, you have other resources available to you. So we have the only online Medicaid dictionary. This is over 2,000 Medicaid, terms, acronyms, and definitions. We have a Medicaid library, an online library of resources for Medicaid professionals. And so these folks who are in the vendor community who need to interact with the Medicaid community, if they need to understand, the new acronyms that are being constantly created, we have those in our Medicaid dictionary, and you can easily get to those and understand what's happening. We have analysts that go through all of the different laws and policies that are affecting Medicaid, and we update our courseware, on a regular basis depending on what is going on and what's changing in Medicaid. So it can be very beneficial to anybody in the Medicaid space.
Well, it's very interesting. It sounds like there's quite a variety of different ways you could go as far as the learning is concerned. Would that be a true statement?
Oh, absolutely. If you go to MedicaidLearning.com, you can quickly and easily see all of our offerings as far as courseware, and there's a basics module, then there's the HIT module, there's the MIDA module, which is the Medicaid IT architecture. This was recently updated in March, and we have a new release of MIDA 3.0, and states are really working hard right now to better understand what's required of them as far as MIDA is concerned and the new 3.0 framework. We have a module on healthcare reform. So we are constantly keeping the courseware refreshed as things change.
Well, great. Yeah, it sounds like it's very comprehensive, and I really want to dig into this when we get back. We're going to have to stop here for our first break. I've already got questions coming in from Instant Messenger through Skype right now. So apparently you're striking a chord here, Marie, with a lot of interest, and I can see why. So we're going to come back here in just a few minutes more with Marie Schwartz and learn more about the Medicaid Learning Center. So stay with us. We'll be right back. Nurses who want to stay on top of their skills know that the Nursing Informatics Learning Center is the place to go. You'll find articles, tutorials, a blog, e-zine, board-approved CE credits, links, assessments, and consultant services, all available to the global nursing community in one place. If you're a nurse or if your organization employs nurses, you need to visit the Nursing Informatics Learning Center.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at mhpa.org.
Elevating the quality of care with less cost. Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is Managed Medicaid Services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new Advanced Care Transitions program, companies can dramatically raise the quality of care without increasing their cost. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
And welcome back to Medicaid Matters. This is the only live and interactive talk show about the business of Medicaid health care. If you're at the MedicaidTalk.com webpage, take a minute now and join our communications list. If you are on that page, you can do it. Just put your email address in there right now, the upper right-hand corner, and you'll stay up to date on all the latest happenings with Medicaid Matters Talk Show, future guests, events, everything to keep you up to date, and that's where you want to be, right in the know. So let's get back to our guest today. And Marie, before we were headed off to the break there, we had some questions come in through our instant messaging through Skype, and I wanted to ask them first. The first question is, what specific courses are part of Level 1 training, and what specific courses are part of Level 2 training?
So if you happen to go out to MedicaidLearning.com, you can see there that I think on our FAQs page we have pretty much that exact same question. And so MedicaidLearning.com, there are 18 virtual classrooms that comprise the Level 1 training. So on the tab that says MLC courseware/resources, the course module that is called Medicaid Basics module, this 18 virtual classroom module, is the one that comprises the Level 1.
Okay.
And then when you combine that with the with the module that's called the Medicaid Information Technology Architecture, or the MITA module, that's what comprises Level 2. And so the two of those together is basically how you obtain your Medicaid Professional Level 2 certification.
Great. And another question is asking you to define the acronym for the certification.
The MCMP Level 1 or Level 2 is our MLC Certified Medicaid Professional.
Okay.
MLC Certified Medicaid Professional.
And that's a certification that comes from the Medicaid Learning Center.
Correct.
Okay. Good. How many people do you have using the materials now?
We are working with the New England states, with the state of West Virginia, the state of Alaska, with the state of Illinois, and we have other states that are in the process of beginning to work with us that have not yet signed contracts. In total, between the states that are using our services and the vendor community, we have approximately 500 people who are in the process or have completed going through the courseware and getting their certifications.
Great. Well, we had our last show, we had a guest, Gwen Williams, and she mentioned several times about how important it is for everyone to stay on top of what's going on in Medicaid, particularly in the area of technology trends. Yeah, the Medicaid Learning Center seems to be such a great one-stop shop. I guess that's probably an overused term, but one-stop shop to go to for this type of training. How has training typically been handled in the past for this type of thing?
For the technology projects specifically?
No, just for Medicaid in general. If I'm a state agency and I'm bringing on a number of new employees and they need to understand Medicaid or they want to become certified, how would someone access that material in the past before the Medicaid Learning Center came along?
Well, that's a really great question. I mean, I think that's part of the reason we exist. In 2006, during one of our MMIS conferences in San Diego, California, there was a work group that was put together to talk about workforce shortages in the Medicaid space. There's a lot of recognition here that many people who've been the leading thought leaders in our space are retiring, and so we've not had something like this in order to bring people into the Medicaid community. I mean, state Medicaid agencies have always tried to provide some level of training for folks who come into their organization, but if you don't have some formal education or some formal training program, what ends up happening typically is that, you know, the person who was occupying that position before you, if you got any chance to train with them, would be the person imparting knowledge to you as you came into a position. But unfortunately, with many of the states, the way that they are able to bring in their new resources requires that the person who is in the position have left already, and so there's always typically a gap, and it's a very big challenge for states to be able to provide any type of training to the folks who are onboarding with them.
Who develops the content in the course curriculums?
We actually worked with quite a large number of groups of people when we began developing out the course content. Some former CMS representatives, former state Medicaid directors, some consultants. We all came together and we worked through, okay, each of you, as you started in the Medicaid space, myself included, with my experience in Idaho, what was it that we needed in those first 2 weeks to a month to really begin to understand Medicaid, set a foundation so we could move forward in our professional career? And we all talked about all the different topics. We went through a ranking procedure, and then we decided how to start building out the courseware as a team. And now we work with a group of consultants that are still typically former CMS employees, former state employees that help us with the course content.
And so it's refreshed on a regular basis, it sounds like.
It is. And also our partner company, Barry Dunn, is a consulting company, and they're consulting and accounting firm, and we have a consulting arm that's basically dedicated to a Medicaid practice. Mm-hmm. And so we have consultants with that organization who are available to us as well.
Well, then, yeah, those are great resources to have. And I want to talk about technology just for a moment, because it's such a hot topic today. And the technology innovations and the use of technology is always a premier topic at every conference, whether it's focused on technology or not. But it's also really rising to the list of the top priorities for state agencies in many, many different states. How does the Medicaid Learning Center support the progression of technology in the marketplace?
The state of Illinois, we just signed a contract with them, and one of the things that I thought was interesting was that Karen McGrath, the Medicaid lead there, she said to me, you know, Marie, everybody who is going to start an MMIS reprocurement project and try to update their MMIS system, the technology that supports the Medicaid program, they need to have their folks go through these Medicaid trainings that you offer, because those types of technology projects are ones that involve multiple different organizations and people groups, and oftentimes they're not on the same page together when they start what we call a DDI project, a design, development, and implementation project. And so there can be delays, there can be challenges, even with just the lingo and the language of Medicaid. And so we believe that the courseware we provide, it really sets a level field for everybody who's going to be on that technology project. So when they come in the room and they start, for instance, a JAD session, a Joint Application Development session, those folks who have all gone through the training together, they're going to understand each other's language a lot better.
Yeah, sounds like it. Very much so. Very much so. That's an area I would think that you would really need to stay on top of and keep refreshed at a more frequent basis than some of the other material.
It's true, and in fact, we just went through a major update to our MIDA courseware because of the MIDA 3.0 framework that was released on March the 28th. And because of that, you know, we're constantly combing all of the information that comes out from CMS and from other state agencies, state and federal agencies, so that we can keep it refreshed and updated. But the MIDA effort was a pretty intense effort for us to get all the courseware up to date.
Mm-hmm. And I want to remind our listeners and our viewers that we have a link to the Medicaid Learning Center right on our show page, MedicaidTalk.com. So if you're there and you want to check it out, please be sure to take advantage of that. Well, Maria, I know you're calling us from the Medicaid Directors meeting in Washington, D.C. I don't know how well that meeting has been able to progress given the status of the hurricane and all the other things that are going on. But what would you say are some of the top issues that you're finding that are being discussed at that meeting right now?
There's a lot of uncertainty around the Medicaid program and the maturity and the progression of it. I believe that there are some key things that are going to be happening here. You mentioned, of course, the election, and I think that the Medicaid directors who are here are all people who have really great ideas and things that they feel they're very passionate about. But I do feel like with the Affordable Care Act and with, you know, some of the aspects of health care reform being kind of, you know, in question of whether or not those things are going to be moving forward. Is there going to be a repeal? Is there going to be a partial repeal? I mean, these kinds of things I think are playing heavily into the conversation at the table right now. Yes,
and I'm going to talk about a few of those things in the latter half of our show today, but I would concur with you, you know, at least in the people I've talked with on our show, with our clients for our business, a tremendous amount of uncertainty is going on right now. And I would assume that that uncertainty and that need to get your hands around, your arms around all the issues in Medicaid would really play well into the material that the Medicaid Learning Center provides, wouldn't you say?
Well, it's interesting you would mention that, because just this morning I was involved in a session, and the president of NAMD is Andy Allison. He's with the state of Arkansas, the Medicaid director there, and he was talking about training and about the Medicaid Learning Center and about how training and getting folks within your organization as up to speed as possible. And again, like Karen McGrath from Illinois said, setting that level playing field for everybody in the room to be able to have conversations really does help. So if the trainings are able to help these states, and especially as new things change, after the Supreme Court ruling, we went through and we did an update to our courseware, and the people who are part of our client base, the states that are already working with us, we sent out an alert to them and we said, go and check this out because this has now been updated. I think this is very helpful to them, and I think that the people who take the courses, especially the state Medicaid agencies, and then some of the consulting community and the vendor community that supply the systems that support the Medicaid programs, they also are needing to be well informed of what the changes are going to be in the Medicaid space so that their systems can be developed to support the business needs of the Medicaid agency.
Right, no question about it. And if you had to maybe name the top 3 training trends or training needs in Medicaid right now, what would you say those are?
Well, I would say number 1 is MIDA, the Medicaid IT Architecture Framework 3.0. When it was released in March, the federal government asked state Medicaid agencies to begin their state self-assessment process so that within a year of the release of what is called the Eligibility and Enrollment Business Area, they could have done a state self-assessment. And so I think that that's definitely a very important part of our training right now is getting the states fully aware of what they need to do to be compliant with MIDA 3.0. The other part of the training that I feel is most important is the HIT. What is going on with the exchanges and the Medicaid organizations, either at the federal and or the state level when I talk about exchanges here. And then thirdly, I would say it's probably around the possibility of member outreach. How are Medicaid agencies communicating with those that they serve, and what are the ways that technology can support that when it comes to the move toward electronic health records, the move toward, taking more advantage of technology even for the state Medicaid agencies to communicate with the members that they serve. Sure.
Well, there's no question that the member outreach component of that is something we're hearing about over and over. And we're going to talk more about that, but it's time for another short timeout. When we come back, we're going to get into more of the details of the Medicaid Learning Center, so stay tuned. Medicaid Matters is now booking guests. Who are we looking for? We're looking for people who can bring a fresh and unique perspective to the business of Medicaid health care. Do you have an idea that is unique, innovative, maybe even controversial? We want to hear from you. Go to MedicaidTalk.com, complete our guest questionnaire, and we'll be in touch with you to schedule an upcoming episode. Be a part of Medicaid Talk.
The Medicaid landscape is changing fast, and that means challenges, but it also means opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
You're listening to Medicaid Matters on the blogtalkradio.com network. Well, you can bring your message to the Medicaid business community by being a sponsor of the Medicaid Matters talk show. Each week we have a listening audience of several thousand. All of them are Medicaid professionals, people involved at all levels of the Medicaid business. You can reach them very easily by being a sponsor. There are several different types of opportunities and ways that you can do that. So email us at info@medicaidservices.net. You'll get more information about joining the Medicaid Talk community and bringing your message to the Medicaid business community. Well, let's get back to Marie Schwartz, who is the Managing Director of the Medicaid Learning Center. And Marie, we were talking about the training trends that are that you're seeing emerge in Medicaid today, MIDA, HIT, member outreach, and so forth. What do you think is driving those trends and innovations?
I think that the Medicaid organizations, and for instance, we work with the state of West Virginia, Commissioner Nancy Atkins.
Mm-hmm.
These people who we get a chance to work with are folks that are very forward-thinking and progressive, and I think that these changes are ones that it really matters to them that the services of Medicaid are helpful to the people who they serve, and I think that the bottom line is, how does the Medicaid program become better and better, serve the people who need the services, be able to provide that network of doctors and providers that provide that care. Mm-hmm. And so I think that just in general, the Medicaid organizations at large are maturing.
Mm-hmm. Yeah, there's a tremendous amount of change moving through the system right now. And I think the need for additional training around those things is going to be, absolutely vital for companies to move forward. But there are always challenges to implementing that. When you have started up with a new organization, provide a training curriculum for them, tell us about some of the challenges that they have getting that implemented and how you can help them overcome that.
Well, I think that I have to back up to even before they become a customer of ours, especially with the state Medicaid agencies and the budget challenges that they find themselves facing. Mm-hmm. What we hear is, oh my gosh, yes, infrastructure is so important, training our resources is important, and then when, we start working with them to try and actually provide the service and for them to purchase that from us is when the challenges become very obvious. And so thankfully the federal government has offered some 90% funding opportunities. Typically in the Medicaid world, training is 50-50 match, 50% state, 50% federal. But with the state Medicaid HIT planning effort, which was part of ARA, the states were able to purchase HIT and Medicaid training at 90% match. So that's been a real benefit to them. And so then once, we've gone over the hurdle of actually funding a training project, then of course there's always the definition of the actual training need, and do the courses that we offer in our certification program serve those needs, or is there additional customized training that needs to be built? As you mentioned earlier, each state Medicaid program is slightly different than the other, and in some instances it's more than just slightly different. And so in some cases, the trainings we offer do a great job of setting that foundation for a Medicaid professional, but then beyond that, a state may want us to customize some additional training for them.
I didn't realize that you could actually create customized programs. Can you maybe give us an example of some different programs or some training curriculum that you've customized?
Sure. With the state of West Virginia, again, as an example, the state wanted to be able to provide an additional avenue for doctors to e-prescribe instead of handwriting prescriptions. They wanted them to move to electronic prescribing. Mm-hmm. And so the state of West Virginia had a project that was just dedicated to that effort, and our organization actually supplied the trainings to the provider community on how to use that technology that West Virginia was supplying.
Okay, so it's not necessarily strictly Medicaid related. It can be, on issues that impact certainly Medicaid. But I mean, that's kind of an interesting example. I wouldn't have thought that.
Yeah, we provide training to Medicaid agencies on more than just the business of Medicaid. We supply training typically for whatever their need might be, some other targeted effort, that type of thing. Our core competency is in Medicaid, and we want to stay kind of within those boundaries. But, as you talk about the state Medicaid agency, about the Medicaid program, there are little tentacles out into other areas.
Oh, yes. Mm-hmm. So would you describe the Medicaid Learning Center as more of a Medicaid training organization, or more as a training organization that focuses on Medicaid?
I would call us a training organization that focuses on healthcare with a specialty in Medicaid.
Okay. All right. Well, that's a little broader than what I would have thought. Interesting. That's very interesting. Well, it is time for the part of our show called the Lightning Round. And this is where we get a very quick, high-level perspective from our guest on some of Medicaid's most pressing questions. So, Marie, we're not looking for detailed academic-related answers here. We simply want a 1-minute perspective from you on each one of these questions. So, are you ready?
I believe so.
Okay. All right, here's the first question. What, from your perspective, what would be the number one impact on Medicaid if ACA is repealed?
I believe the Medicaid organizations are going to have to start a very intensive review of what they have already done to date and what has to be done, either to stop that action or to continue that action with state dollars only.
Great. Okay. What would you say is the number one Medicaid priority for state governments?
The number one priority should be the people that they serve.
Mm-hmm. Great. What do we need to do more of in Medicaid today?
Of course, this answer is biased. We need to be able to improve the workforce in Medicaid and provide additional training to them. I mean, that's been my passion for quite a while now, and I think the work groups that have been formed reflect that there's a lot of people who are leaving the Medicaid space with a huge amount of knowledge going out the door with them, and we've got to replace that, and we've got to do it well.
Great. What do we need to stop doing in Medicaid today?
That's a very difficult question. What do we need to stop doing in Medicaid today? I think we need to stop and take a harder look at the types of relationships that Medicaid has with the provider community, because I think that oftentimes, unfortunately, the provider community doesn't understand the Medicaid program at large, and so they end up in this not necessarily hostile relationship, but in a relationship that isn't pleasant with the provider community. And so I think we need to stop and see how can we improve the relationships that we have with the provider community and educate even the providers a little bit better.
Great. Interesting. Thanks. Great. And here's the last question. The best singing competition, American Idol or The Voice?
Oh, The Voice.
Well, The Voice is winning in our poll, in our lightning round questions. So, great. Well, good job. I appreciate you taking the time to do that. Did a great job. I know that's tough to be on the spot like that. So, appreciate you doing it. Well, we're about out of time in this segment, and I wanted to leave it open here for just a minute and ask you, Marie, if you have any final thoughts about the Medicaid Learning Center, anything new coming up that we want to know about, and just anything you want to include that maybe we didn't touch on.
Well, the only thing I want to just make sure that I mention for the viewing audience, in case there are folks that are viewing or listening from state Medicaid agencies, is that the 90% match from the federal government on the HIT and Medicaid combined trainings that we offer isn't going to last forever. And so I think that states who want to take advantage of that, or governors who want to see their Medicaid programs take advantage of those additional funds, would want to move on that quickly. And then lastly, the other thing I'd like to mention is that We are seeing a trend in the Medicaid space towards the recognition of Medicaid professionals. When you look at the ongoing operational budgets of a Medicaid organization and you look at their medical professionals like social workers that are licensed and nurses that are LVNs or RNs, those people get a 75% match on their salary, and so the feds pick up 75% and the state pays 25%. And we would love to see the federal government recognize a certified Medicaid professional and allow those Medicaid professionals to also be to be matched at 75% and help those state Medicaid budgets with that type of salary situation.
Great. Well, I want to remind again our listeners that you can get to the Medicaid Learning Center right there on our page at MedicaidTalk.com. But Marie, if somebody needs to get a hold of you, what would be the best way for them to do that?
The MedicaidLearning.com website, www.medicaidlearning.com is our website. We also have www.providerlearning.com for the provider courseware that we offer. So, reach us through our website, ask us, or contact us buttons. That's the best way.
All right, great. Well, Marie Schwartz, Managing Director of the Medicaid Learning Center, we thank you very much for being on our show today, and we look forward to great things from the Medicaid Learning Center. Maybe we can talk about those again sometime next year.
Thank you so much, Richard. We really appreciate the opportunity to be on your show.
Great. We'll talk to you again soon.
Okay, thank you. Bye-bye.
All right. Well, we're going to go to our last break, and then we're going to get into our last segment here on the show today. When we come back, I'm going to talk about some of the implications that the presidential election could have on Medicaid. So stay right with us. I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
And welcome back. This is Medicaid Matters, the only live talk show about the business of Medicaid health care. We're here every other Tuesday, 1 p.m. Eastern Time. We're glad that you're joining us. Well, here in our last segment for today, we're going to talk about some implications the presidential election might have on Medicaid. Would love to get your perspective as well. We have about 10 minutes or so here left in the show. You want to call in at 626-657-2125. Be happy to get you on the air. But it's 1 week away, and we're counting down to the election. This is being billed as one of the most historic, important, far-reaching presidential elections in history, perhaps so in my lifetime. There is no question. There is a lot at stake on some very important issues. And I want to spend our remaining time here talking about how the election could potentially impact Medicaid and what we might be seeing in the near-term future. There is just a tremendous amount of material being written about this right now. I think one of the biggest Medicaid issues at stake in the election is whether states will expand Medicaid or not. And we got some guidance from the Supreme Court back in June that essentially says it's not going to be mandatory. There are implications to both directions. The impact of whether not to expand is going to be felt, believe it or not, in the private insurance marketplace. I mean, that's right. A state's decision about Medicaid expansion is going to have an impact on private insurance on private insurance premiums that people are paying. Now, I recently read a study that was released by the Academy of Actuaries that concludes that there are really going to be three broad impacts on private insurance if states do not expand their Medicaid coverage. And of course, expansion is going to be a big issue as to what happens after the presidential election. There really were, as I said, three broad areas that came out in this study. The first is that if states opt out of expansion, the Academy is stressing that the cost for private insurance, not the cost of government-sponsored, the cost of private insurance is going to go up. That's not exclusive of government, but of government-sponsored programs, but the cost of private insurance is going up. The second thing that their study concluded is that without expansion, less healthy people who would otherwise be eligible for Medicaid will get subsidized private insurance. And because of this adverse selection, that's going to drive up the cost of benefits for everyone. And third, small companies with low-wage employees are going to be penalized. Now, if a business does not provide benefits to employees, those employees will be mandated to purchase subsidized private insurance, and the business itself is going to be penalized, a cost that is sure to be passed along in either lost jobs or higher prices. If the employees were otherwise covered by Medicaid as a result of the state's expansion, then the business would not be penalized, and that's all according to this study. Now, we're going to put a link to a very short article and synopsis about this study on our webpage, and you'll want to go and check that out and get more details. But of course, on the flip side, they're saying there's a cost in the private insurance world for not expanding. On the flip side, Medicaid expansion is going to cost states a great deal financially if they do expand, even with the federal subsidy. For example, in Mississippi, which already has 710,000 people covered by Medicaid, expansion would add about 300,000 people working in low-wage jobs right now. The study concluded that the cumulative cost of the state to add these people would be $1 billion from 2014 through 2025, and that is after the federal dollars of $11 billion more are factored in. And the governor there says the state just cannot afford to participate into that level of expansion. So it's almost, darned if you do, darned if you don't type of scenario with respect to expansion as we move forward. And we're going to post a news article that gives more details about this so you can dig into it more. But I think the whole issue of Medicaid expansion is going to be closely watched, as it should be, following the presidential election. And the impact is going to be pretty interesting. And here's why. Some states, all the states actually fall out into three broad camps. There are those that have already said they are going to expand. There are those states that have elected and said that they're not going to expand. And then you have the vast majority of states who are saying they're undecided. Now, whether they're really undecided or not, I think remains to be seen. But I think a lot of that, how they're going to announce whatever the decision it is that they've made, is going to hinge on the election. As you know, President Obama is urging states to expand. It was a centerpiece, or a main piece, I should say, of the Affordable Care Act, and something that is the hallmark piece of legislation of his presidency, no doubt. Governor Romney says that he's going to repeal ACA, and of course his running mate, Paul Ryan, was a proponent of the block grant, which would provide states with blocks of money essentially to do as they decide. So there are three camps that states have broken out to here on this, and let's see if I can put it up here on the screen so you can see a map of what that looks like. Okay, you should see it now. Now, 13 states have accepted Medicaid expansion, and those are the states in blue on the map. There have been, states in blue on the map. The largest camp, which is the all that white space on the map there, are undecided about expansion. No doubt waiting to see what happens in next week's elections. And 6 states have already announced that they're rejecting the expansion, and those are the states in red on the map, mostly citing the financial burden that is required as a result of trying to expand Medicaid. You know, perhaps the place where the debate has been more prominent than others has been in the state of Texas. Texas is a state that has been moving and innovating in Medicaid for several years. I want you to listen to a perspective about this from a news report that was in the Texas Tribune.
If President Obama wins a second term and the Affordable Care Act stays the law, then the debate swings to whether or not Texas joins in an expansion of Medicaid. Governor Rick Perry says Texas will opt out of that expansion, but Ann Dunkelberg thinks the state's largest counties, which have the most to gain monetarily from joining the program, may join together to force the expansion. Dunkelberg is with the Center for Public Policy Priorities, a progressive state policy think tank.
I don't see them doing an end run. I do see them potentially coming together and trying to figure out if there is a way that they can come up with the rather modest less than $1 billion a year that the state would need to do this expansion.
Conservatives hope a victory for Governor Mitt Romney would be the end of the ACA, but it could be the beginning of new Medicaid block grants. Arlene Wolgemuth is with the conservative Texas Public Policy Foundation. She says multiple states have been asking the federal government for the freedom to spend Medicaid dollars the way each state sees fit.
Governors are saying we can do a better job for our population than what you're doing with this straitjacket that we have coming from Washington. Our research shows that we can deliver better care for more people if we were just given the flexibility to design a program for Texas.
She says one example of block grant savings would come from instituting a sliding scale that would have families paying modest copays for coverage based on their income.
We can save so much money and get the most money to those who need it the most. It's so common sense that everywhere except Medicaid, we're using it. So it's time for Medicaid to catch up with that public policy.
No matter who wins, you can bet any future health care debates will include discussions on abortion, a topic not directly tied to the Affordable Care Act, but one that Dunkelberg says can hamper policy discussions.
When arbitrary issues become these enormous symbolic, philosophical, hot-button issues in the political debate, policy stops being made in the middle where it probably belongs.
But first, lawmakers will need to pass a supplemental budget in early 2013. Without an infusion of about $4 billion, the Health and Human Services Department is expected to run out of money for its Medicaid programs by April. Reporting for KUT News and the Texas Tribune, I'm Ben Philpott.
So Ben Philpott's a senior reporter for KUT-FM, Austin's national public radio affiliate. He's been covering the state politics and dozens of other topics for the station since 2012, during which time he's been recognized as outstanding in journalism. So great segment there from him. We appreciate hearing from that. Before we go, I want to just tell you about the fact that, as you can tell, a lot of innovation is going to take place in Medicaid coming up.
90 seconds.
And what we're going to see is a need for everybody to be on top of what those innovations are all about. That's why I'm going to be hosting and chairing the Medicaid's Innovation Conference next February in Orlando. So I want you to make plans to be there, and we can certainly help you out by providing you a $200 discount on the cost of attending that conference. If you are signing up for the Medicaid Talk, MedicaidTalk.com news information there, just put your email in, and we'll be able to send you a discount code that you can apply when you're registering. We're going to have more about that between now and February. There's certainly a link on our website for you to get more information there as well. Well, we have covered a lot today. I hope you got it all in. We'll have a replay available to show shortly afterwards if you didn't. why not invite a colleague to become a member of our audience as well? Just send them the link. And I want to thank Marie Schwartz for being on the show with us and spending time today. We will not be having a show on November 6th. That is Election Day, and I know our well-informed and intelligent audience will be at the polling places casting their votes. So we'll catch you shortly after that. You've been listening to Medicaid Matters. Today's Tuesday, October 30th, and this is Richard Yaden. We'll be talking again very soon.